Nationalism here at the SIEL conference. We have I know everyone says it, but we have both a distinguished and excellent panel who I think will additionally be really interesting. And we have experience from global governance to government to industry to discuss this topic, which is just about the most important one on the planet at the moment, to talk about how we get vaccines where they need to be, barriers may have been. So this panel is going to focus on solutions and ideas that can help address the problem of vaccine inequity. That means asking how we got to where we are just now and working out where. It's all aimed at lessons that can be learned and carried forward to the next phase of the COVID-19 pandemic and, of course, future crises. So with some thanks to I'm just going to use a couple of figures to frame where we're at right now. And I think there are 3 data points that can help sum up where we're at. So vaccine production could exceed 10 billion by the end of the year through the pipeline, so different manufacturers. China, India, the EU, and the US remain the biggest vaccine producers in the world, absolutely towering over others. And lastly, Kovax commitments, this distribution program that was meant to help reach less developed countries or less frequent vaccine producing countries, made by some of the greatest vaccine producers and some of the richest nations, as we stand at it right now, fall quite short. So we have, as established, very unequal distribution. And what we're going to do first is we're going to turn to our panel for a brief introduction. We're then going to have a session where I ask the panels for some of their lessons and solutions to the problems we've described and they've outlined in their open. But what's really important is that throughout, as these questions occur to you, please use the public chat function. I really want it to be an interactive discussion. It's not a lecture. So please make sure that you join in and offer your thoughts as well. Make sure you make the use of the panel's expertise by asking those tricky questions. You'll see the public chat function on the right-hand side of your please just don't be afraid to draw my attention to your question. Just shout at Anna if you're not getting through. Now, I'm going to turn to our panel. They're going to give, and they've promised me it will be brief, outline of their experience and their thoughts that they think will help frame today's discussion. And we're going to start with Lothar Ehring. Lothar is a senior expert in the European Directorate General for Trade, and he's a trade lawyer who formerly worked at the WTO Secretariat. So there's few people better placed to offer a nice opening overview of where we're at and what it's been like to be on the inside, perhaps. So if we turn to you, Lothar, if you could set us off with your opening remarks, please. You're on mute, Lothar.
If the world was one country, vaccine distribution should be governed by the rights to life, health, and equal treatment. The government would step in, not leave allocation to the market. Distribution would function like in many countries, the more vulnerable people first. Distinctions in access based on epidemiology, not nationality. The real world is organized in separate states. They're making the decisions, so we must assess vaccine distribution from their perspective. I'll do this in my personal capacity, not on behalf of the European Commission. International trade law binds states. It doesn't require restricting exports, but it allows it. Article 11.1 of the GATT, which exists in every trade agreement, prohibits non-tariff restrictions on exportation or sale for export. An export ban. A required authorization that's not automatic. 11 catches other forms too. These examples are taken from the real world. Mandatory domestic sale, priority for domestic buyers, contractual restrictions on exportation. International trade law does not care about the internal domestic form. A condition for a subsidy or investment. An informal request that's followed. But government purchase alone is no export restriction, although the government is a domestic buyer. Procurement at home is allowed. WTO members can even prescribe it. Perhaps the producer sells to the government because otherwise it'd be seizures, or the government secures a contractual position beyond the standard rights of a purchaser. Those would be export restrictions too. The WTO, by the way, requires notifying all measures under Article 11. But there are exceptions. GATT Articles 11.2a, 20b, and 20j. One is enough. 20j sounds suitable. Measures essential to the acquisition of products in short supply. It requires an equitable share for every WTO member. 20b doesn't require that. It allows what's necessary to protect health and life. That can be life on the domestic territory. Not long ago, most trade lawyers thought 20b allows nothing other than protecting life on the domestic territory. The Article 20 chapeau bans arbitrary and unjustifiable discrimination between countries where the same conditions prevail, plus disguised restrictions. This and necessity are highly relevant. First, because of available alternatives that are equally or more effective. Think of non-pharmacological interventions where they work in a country. The three-prong necessity test. Life, death is super important. A non-deadly disease, less so. If you vaccinate populations with almost no mortality risk, that's a very low contribution to saving lives. Hoarding vaccines for uncertain later use makes no contribution to saving lives at the moment. The trade restrictiveness is harsh. This is not about other countries' access to some widget. It's a life-saving vaccine. It's about preventing deaths in their countries. So there are situations where the necessity fails, but domestic preference is allowed. Different conditions prevail in countries when they don't need vaccines to the same extent right now for saving lives. They may have their own production, may have vaccinated more people already, may have different demographics or infection rates. Discrimination in favor of the domestic population is justifiable and not arbitrary because governments are primarily responsible for their own population. Article 20 is not directly relevant where 11.2a works. It even comes first amongst the exceptions. Whose interrelationship I don't have time to go into. Temporary restrictions against critical shortages of products essential to the exporting country. Here you go. But remember some of the situations in which 20 should fail. They may well be relevant too under critical and essential. So trade law allows export restrictions and national preference, but to an extent. It requires some sharing, but not equal access. Do human rights provide otherwise? No. They can even require export restriction. Remember, life, health, equal treatment. These are not only limitations on government power, but also positive obligations. But other human rights impose limits, and there are other interests that come in too. The interest to save the highest number of lives domestically and to save the most lives overall. Solidarity, diplomacy, and cooperation are legitimate, for sure, in fighting a pandemic that travels between countries and variants. But there's no extraterritorial obligation, national or international, on states to give equal worldwide access to vaccines. Statements to the contrary notwithstanding. The obligation of equal sharing doesn't even exist between the member states of the European Union, a highly integrated regime. A few words on ethics. Every human life is of equal worth. Clearly, scarce vaccine distribution is a dilemma, but decisions can be made ethically. Not deciding is also deciding. It's ethical to give priority to the domestic population to which a government is answerable, and which is the society that achieved vaccine development and production. But there's a limit. If it's ethical to try to save as many lives as possible, it's not ethical to save one life at home with a number of vaccines that could save 10 lives abroad, or thousands. These are realistic numbers given the asymmetric mortality risks and vaccination progress. In closing, these are important questions. They're about life and death in the thousands per country per day. Maybe you know things of bigger immediate importance. Apart from limiting this dilemma by producing as many vaccines as possible, I don't.
Brilliant. Thank you so much, Lothar. Really interesting where we're at in terms of the legal situation and human rights situation. Next, we have Rachel Silverman. Rachel is a policy fellow at the Center for Global Development. Brilliant, fantastic. Rachel, if you could just ask you to unmute yourself. Perfect, off we go.
Okay, well, thank you, Anna, for the introduction and for the organizers and fellow panelists for this invitation and joining. So I'm going to kind of take this from a rather different perspective. I have no legal background whatsoever. Economics and global health policy and financing. So that's really the lens I have on this. So, I think we can all agree that if we're looking at the global situation and the level of inequity, it's morally appalling and practically self-defeating at this point, as we have the new variants arising that are being re-imported even to the wealthiest, most vaccinated societies on Earth, and are really threatening what people hoped would be this return to normal. So, I think, granted, we are in an appalling situation. But I do want to challenge maybe some of the popular narratives about how we got here, because I think that's an important framing for where we go from here. So I have, from my perspective, I think 3 myths to debunk in the popular conception of how we got here. Maybe not everyone shares these views, but certainly they're things I hear a lot in my circles. So the first myth is that rich countries hoarded vaccines through pre-orders, that they ordered way more than they needed, and that is sort of the root cause of the inequities we're seeing now. I think that's partially true, partially false. I think what people forget is that if we go back in time to when these pre-orders were being made, there was a lot of uncertainty about which, if any, vaccines would work. And I think a very valid alternative perspective is that rich countries were actually effectively subsidizing the R&D by paying for the risk of failure in a scenario where it was very possible that none of the vaccines would actually work. And they could afford to do so, right? So I'm not saying that poor countries should have been doing this. Rich countries had the luxury that this was something they could do with the money. And I also want to be very clear that that is not an excuse for hoarding or not sharing now. We're in a different moment now. But in terms of how we got here, I think some people point to that as one of the original sins that rich countries bought up. When that and a lot of them would not have come contribution from wealthy countries. Myth 2 is that price and profits are the problem here. There's a complicated IP debate. I think I'm going to put that to the side. We can get into that later maybe. But I think that if you look at vaccines now, they are all priced at extremely cost-effective levels in basically any country on Earth. And the fact that we actually have shortages from an economics perspective suggests that vaccines are, quote unquote, underpriced from an economics perspective because the market is not clearing. There is more demand than there is supply. And countries like Africa have no problem, or countries in Africa, for example, are placing orders at the market rate. It's not that they are unwilling or unable to buy at that rate, but there is not supply to meet their demand. Again, that's not to say that all profit is good or all company decisions are good, but I think sometimes there is a framing of, Pfizer is realizing these obscene profits. This is not a normal market in this sense. The profit margins are relatively low for an originator product or for an innovative product. And again, the issue is that there is not enough supply, which again, from an economics perspective, is really a sign of underpricing. Myth 3 is that there would be plenty of vaccine available now, if not for patent monopolies. And again, I'm not talking about the entirety of the IP debate. I'm really just focused on this narrow point. Again, going back in time, we did not know which vaccines candidates would work when production decisions were being made. And with the possible exception of the Serum Institute, none of the producers were willing to produce at risk without some sort of subsidy or advanced purchase commitment from governments, because they didn't know which vaccine they should produce. And there was a very high probability that if they converted their production lines to some vaccine candidate, they would have a bunch of useless product on their hands and no one to sell it to. There was very high commercial uncertainty and scientific uncertainty at the time these decisions were being made. And I think you can also see that in the fact that originators themselves are struggling to, scale up to meet demand. Again, that's not to say that patent monopolies right now are not necessarily problematic. They could be. But I think, again, if we're looking back in time, it's important to kind of have a clear-eyed picture of what was happening at the time these decisions were being made. So what actually did happen? And I think this has relevance, this is my final thought, and has relevance going forward. The original sin was penny pinching. The original sin was not giving way more money to this effort in every way. I think this is mostly on behalf of wealthy countries who bought for themselves, but did not think about the importance of scaling up for the entire world, who underfunded Kovax. I think we've seen that with enough money, incredible things can happen in terms of accelerating R&D and manufacturing timelines. And if we had had way more money from the start, and their rich countries were not only willing to absorb failure risk for themselves, but for the entire world, we would be in a very different situation. So I guess with that, I'll leave it and go over to the other panelists. Thank you.
Much, Rachel. And next, we are very lucky to have Ambassador Bhatia. His experience is very extensive. He's an advisor to the Council on Economic Policies, but also, I think, a very unusual offer many years' experience at the WTO, including in its dispute settlement arm, the appellate body. So if we could go to Ambassador Bhatia now. Thank you so much.
Thank you, Anna. I'd like to begin with some initial comments on the issue of global institutions that are required to address such pandemics. First, a little context. It is widely accepted that climate change is the biggest market failure in world history and requires globally coordinated approaches. The Paris Agreement is a very imperfect instrument, but it does provide a framework for such a globally coordinated response. The world's approach to climate change and the broader issue of sustainability through the Paris Agreement, the Sustainable Development Goals, and similar measures reflects an understanding that piecemeal or national approaches to threats to the global commons are not enough. No one is safe till everyone is safe. Like climate change, the global public health impact of the COVID-19 pandemic, along with the economic and distributional aspects of vaccines and treatments, involves a similar market failure without the underlying institutional safety nets for an effective, globally coordinated response. Since last year, we have witnessed a strikingly large number of countries, including the most powerful ones, pursuing nationalist policies which have seriously disrupted the flow of global value chains, exposed the helplessness of institutions like the WHO and the WTO, and gutted whatever framework there was for global cooperation. The recent G7 pledge to supply vaccines to low-income countries exemplifies this situation. Essentially, the G7 is telling the rest of the world, yes, we hear you, we know you have a problem, but bear with us while we fully immunize our citizens, and we'll be with you shortly. If the world is to address future crises more effectively, it cannot rely on the uncertain munificence of a few countries. It needs strong, self-standing institutions with clear mandates and resources to make effective interventions. This implies action at three levels: political, financial, and regulatory. At the political level, a global summit mandating action on an integrated plan for preparedness and response to such pandemics across global institutions like the WHO, the WTO, and the international financial institutions. The plan would have automated trigger points based on a global surveillance and alert system for the mandated agencies to intervene without requiring any political decisions. At the financial level, a mandate to international financial institutions to intervene effectively when trigger points sound the alarm. At the regulatory level, confining myself to the WTO, it would require a revisitation of the rules regarding export restrictions and intellectual property. As we have seen, the WTO rules regarding export restrictions are at present too accommodative to allow for a quick global response. And yet there is little political impetus to tighten them for reasons that are obvious. As far as intellectual property is concerned, the first step is to the solution is to accept that we have a market failure problem that cannot be left to markets alone. The second step is to avoid looking at it as a binary issue. It's not more manufacturing and licensing versus relaxation of IP rules. It's both. The world needs widely dispersed manufacturing capacities that can only be meaningfully achieved in a regulatory environment which facilitates technology transfers, access to regulatory data, and to trade secrets. Thank you.
Ambassador Bhatia. And now we have Carlos Correa, who's Executive Director at the South Center, and he has particular experience in intellectual property issues. Thank you so much.
Well, thank you, Anna. Thank you for the invitation to participate at this conference. Let me first mention that in April last year, the Secretary General of the United Nations made a statement about the need to consider all products needed to address the COVID-19 crisis as global public goods. This concept was actually echoed by some head of states at the World Health Assembly that took place in May that year. But as we know, this has not been the practice. The practice has been that the products, in particular vaccines, which may be used in order to fight the COVID-19 disease, have been subject to the usual commercial practices, in some cases monopolization of the technologies, and therefore this concept has not been implemented in any way. When resolutions were negotiated both by the UN General Assembly and also in the context of the World Health Assembly, the concept of global public good was used not in relation to products, but in relation to immunization. That means the outcome of the use of products. But there was a rejection on the part of some developed countries to accept the concept that these products should be global public goods. In September 2020, the World Health Organization issued a framework for distribution of vaccines. In accordance to this framework, the objective was to ensure that at least 20% of the population of all countries would get the vaccine as early as possible, in particular to vaccinate health workers and the vulnerable people. But as we know, has already been mentioned, the distribution of vaccine has been so unequal. This is a real shame for the international community. Maybe this may be one of the catastrophic moral events in the 21st century that will be recalled later on as one of the major failures of the multilateral system to ensure an equal distribution of this key tool in order to combat the COVID-19 disease. In the context of these ideas of having products as global public goods and ensuring an equal distribution of vaccines, two mechanisms were set up. One was the so-called CTAP. This was based on an initiative by the President of Costa Rica to create a pool of technologies in order for sharing technologies and increasing manufacturing capacity, which is a major limitation, has been, and still is a major limitation in order to ensure an equal distribution of vaccines. But the CTAP, as you may know, remains empty. There's been no single pharmaceutical company that has shared the technologies in order to facilitate the expansion of manufacturing capacity, whether in developed or in developing countries. And the second important facility, which is very well known today, is the Kovax Facility. This facility had the objective of distributing 2 billion doses by the end of the year. And right now, in accordance to the last information published by Kovax, they have been able to distribute just 95 million doses. So it's very, very low in relation to the objective that was set. So both mechanisms have actually failed. And this is something that then should be looked at in the context of perhaps international law. So what are the main problems in summary? One is the shortage of supply, that has already been mentioned. So the fact that there has been no technology transfer, no interest at all by the companies, the so-called originator companies, to share technologies. It has limited the capacity to produce vaccine, and this has limited the capacity of governments to act as early as possible. And this is one of the issues that needs to be addressed. And as we know, there have been some companies in Israel, in Pakistan, in Canada, asking for licenses in order to produce vaccines, and they were denied. There was no response on the side of the originator companies. And in addition to this, there is capacity to produce more vaccines in both developed and developing countries, idle capacity, and in many cases, plants which produce biologicals could be repurposed without not so much difficulty in order to produce vaccine, but this has not happened. So this is a major problem, the shortage of supply. And the second problem, of course, is the lack of a scheme for an equal distribution of vaccine. That has already been mentioned by Mr. Lothar Ehring, the lack of any legal obligation in terms of ensuring an equal distribution of vaccine. So the question now is, and the context of this conference, I think is particularly pertinent, what the role of international law may be in order to address this situation and hopefully avoid that this situation repeats again. As you may know, there is now a proposal that has been launched by a number of head of states and also supported by the World Health Organization to negotiate what is called a pandemic treaty. So the question is will the pandemic treaty provide any solution? For sure, it will not provide a solution for the current crisis, because negotiating a treaty takes quite a long time. It may take years. But in any case, it may help to address future pandemics. But then if this is the case, what the content, objectives, and scope of this pandemic treaty should be? Will it just ensure that the pathogens are shared, as may be the objective of some of the proponents of the treaty, or that the liability of companies is looked at? Or will this pandemic treaty include, for instance, a research and development model that will ensure that whatever is produced on the basis of research and development is then produced as a global public good and not on the basis of monopoly, as has been the case in this situation? So will this pandemic treaty ensure equal distribution? Will there be provisions, legal provisions, ensuring that the framework, for instance, of the World Health Organization adopted in September 2020 will actually be implemented? Will it allow the expansion of local production? So there are many questions that the negotiation of this treaty raised right now. It is maybe a promising avenue, but it will be very important for all members of the World Health Organization to be engaged in this exercise. And importantly, if there is an outcome, at least in my view, the World Health Organization tool should be strengthened. So it shouldn't be a question to create a new organization outside, a new body outside the World Health Organization, as has happened in the past. But what is key, in my view, is to strengthen the capacity of the World Health Organization to act effectively. It was already mentioned by Ambassador Bhatia, to act effectively in situations like this. So thank you very much again for your invitation.
Very much, Carlos. And now, Koen Berden, Executive Director for International Affairs at EFPIA, which is a European Pharmaceutical industry group. And he's also Assistant Professor at the University of Rotterdam. Koen, if we could come to you.
Yes, thank you very much, and good morning, everyone. It's great to be here, and thanks for the invitation. I'm happy to share some of the insights very much from the ground in terms of producing from the industry perspective. And the angle I'd like to take is to talk about indeed what steps are really needed to address that immense challenge in terms of vaccine equity. Yeah, and the challenge we face in terms of the vaccine nationalism that we see today. Maybe the spoiler right up front, the key solutions that really are vital for helping vaccine equity are related to significantly stepping up dose sharing, and that is also, as we'll see in a moment, going to be more possible as production is being ramped up. Continue the optimization and ramping up of production of vaccines, because that is something we all needed yesterday. Removal of trade barriers that stand in the way of what is being produced reaching where the demand is. Support country readiness. I don't hear that much about this, but also support country readiness for vaccine rollout campaigns if large amount of vaccines suddenly need to be distributed, and driving further innovation. So if I'll share my screen for a few kind of background, let's say, informational slides to what I would like to share. I hope you can all see this. Is that correct, Anna? So you already mentioned the production element, and I think it's really important to highlight where we are. When we started in January, there were 200,000 vaccines produced. In end of May, that was almost 2 billion. End of June, 3.5 billion. So we've just crossed the 3.5 billion threshold. And that is really important also when we look forward to the end of the year, because these commitments in terms of producing would simply mean you add 1 billion to the existing levels of production each month to reach that 11.5 billion by the end of the year. Those contracts have already been signed in terms of supplies, in terms of production. In fact, what people should really realize is that a vaccine that is coming out and being produced today, the production decision was made 4 months ago in February. March is the decision made for what comes out today, because it takes 2 to 4 months to produce a vaccine. And that's because of the natural way it goes. 2 months for the mRNA vaccines, 4 months for the vaccines that use live samples. The other, I think, important point is that we are where we are because of the R&D efforts undertaken. And the mRNA technology was applied last year for the first time to COVID-19 vaccines in the Moderna and Pfizer vaccines. But the mRNA technology started already in 1990. And it has had various and many years of development in order to get to where we are today. And we're lucky to have the mRNA technology at the stage where that is now, but that was a lot of work until that moment. We have 12 vaccines approved today in different parts of the world. Bharat in India, China, Cuba, Russia, US, J&J, Oxford, AstraZeneca, Moderna, BioNTech, Pfizer. You have the Sinopharm, Sinovac, and also Vector in Russia again. So it's important to realize that that has been a long-term effort. At the same time, R&D on vaccine efficacy against variants, making sure that the vaccines also beat the Delta variant is going on, and the R&D into booster vaccines for the longer-term safety of patients once the original shots start to wear out is already ongoing, because this is a long-term process. It's amazing that in 326 days from the announcement of the code of SARS-CoV-2, the Pfizer vaccine got its emergency approval in the United States. That is unprecedented in history. And we need that long-term R&D to also make sure we become safe for future pandemics. Now, the key element, of course, lies in manufacturing. That too is an unprecedented effort and complex. And I think it's maybe important for a few seconds to highlight the complexity in producing a vaccine. It is precision. It is the expertise that is needed. In the beginning, that production was trial and error, and even the original vaccine producers had challenges in ramping up production, faced hurdles, unexpected setbacks that had to be overcome. It involves cutting-edge science and technologies that you need to deal with that have not been used before, especially the mRNA vaccines, and it has to meet the highest regulatory standards to get regulatory approval. EMA reviews...
Koen, sorry to interrupt you. Sorry to interrupt you. I just want to make sure that we get your slides moving because I think they're really complementing what you're saying, and you've got...
That's
just wondering.
fine. Yeah. So here you see how long it takes to set up a factory, 2 to 3 years from the start of production. If you already have a vaccine production facility, to repurpose it for COVID-19 vaccines takes 6 to 12 months. So if today we would repurpose a factory, even with vaccine expertise, it takes 6 to 12 months. In 12 months, looking at the prognosis for production, we're at 15 billion vaccines. So that is the key question I think we need to ask ourselves. What is vital here is the fact that there has been a lot of tech transfer. There have been 225 technology transfers signed of a total number of deals of 307. And that number is increasing on a weekly basis. And that number happens after companies screen hundreds and hundreds of possible sites to produce. But they have to meet very rigorous standards also from a regulatory standpoint. Now, in terms of the complexity here, why is it so important to do this? The Pfizer vaccine needs 280 ingredients that come from 86 different producers in 20 different countries. If you have one site where that's concentrated, that's already immensely complex. If you have multiple sites, the supply chain gets almost unmanageable. So it is a very careful process to calibrate how to ramp up production. And we see that some of the companies, like the largest producers of vaccines, 2 Chinese, Pfizer, are the top 3. They all have 1 or 2 plants in order to use scale economies to ramp up production as fast as possible. Why is the voluntary tech transfer so important? The reason for that is that in practice, it is most important because forcefully obtained IP may give you the blueprint for a vaccine, but it doesn't enshrine the collaboration that is vital to share expertise, tips and tricks on where to work, how to increase production, how to transfer the know-how, sharing of the expertise, and joint trainings of skilled workers. That happens in a voluntary tech transfer, and that is really vital for the process. So what is the real risk for manufacturing? The real risk for manufacturing is the availability of supplies after December 2021. Until then, contracts are signed and also raw material production is ramped up, but after that, there will be a challenge. Because we already see as an industry, for the long-term contracts, shortages of raw materials. And that's not just for vaccine production, that's also for the regular vaccines. We produce 5 billion vaccines a year for the flu and for all kinds of other diseases. We also see that other products that need the same ingredients, oncology or hematology or infectious diseases, other infectious diseases need raw materials. So that is going to be a key question. Now, to end my intervention, because it's already mentioned before a few times, the export restrictions are really important. Here you see the latest figures of the 7th of July, in fact, with respect to China, how much it produces, and the share it exports. China has exported 24% of its production. The EU, nearly 40%, the US, 11%, and a country like South Korea has exported 78%. That is going to be vital in order to do this. And we've seen several, let's say, elements where that has been hampered, and that is an issue. Some countries have exported a lot, and from an industry perspective, we very much support and work together with CEPI on as an independent platform to look at matchmaking input gaps. And we work together with the Kovax Supply Chain and Manufacturing Task Force, because that task force facilitates voluntary matchmaking for fill and finish capacities that industry is working on. Maybe those are some of the key issues I would like to highlight, including some of the elements that then follow from this for solutions. I'll stop here, Anna, and give the floor back to you. Thank you very much for your attention.
We had a little trouble seeing, sorry, if I wasn't clear, we had a little trouble seeing some of your slides. What I'd And what we might try and do is very near the end, just hop through a couple of the charts, and perhaps when I give you guys a quick fire summary moment. Also, it'd be brilliant if you could perhaps share them on Twitter as well. We can sort of sum up a few points in the discussion and share a couple of those charts. Okay, so we've got some brilliant questions coming in from the floor. We're going to take those in just a moment. I'm just going to offer up an opening question, which is, we've touched a little governments and forums and how they haven't really fulfilled what they needed to fulfill in terms of having that global overarching solution. So if we could start with Lothar on why perhaps the WTO and trade law specifically, these international mechanisms have fallen short in finding a solution here to the vaccine nationalism problem, as it were. With these ones, if everyone could be as brief and quick fire as possible, just to allow the brilliant questions we have coming in from the floor, that would be great. So if we start with Lothar, and then we're going to come to Ambassador Bhatia, and then Carlos on this one.
Well, as you heard, I believe that the trade law gives actually more answers than many think. Ultimately, this is about balance, even if it is not about equal treatment. And when you look at the WTO agreement, the rights, obligations, and exceptions, you look in parallel at international and national human rights law, you come, in my view, plus ethics, politics, even economics, you come to a solution that is in harmony, which is nice and also legally important, because in reality, the analysis even is much more complicated than I presented it, notably because other international law that applies between the same WTO members is context and to be taken into account in interpreting the WTO agreement. But there's harmony, and that harmony is not the obligation of equal treatment. But there's also no right, as Ujal formulated it in this statement, which was not his statement, but what he quoted, bear with us while we fully vaccinate our population. That is wrong. It's legally wrong, it's ethically wrong. And I gave you the reasons. And this is a very topical question right now, because in certain countries, children under the age of 16 are being vaccinated en masse, irrespective of comorbidities, and therefore an actual mortality risk. Yeah? Can you justify this? And you hear very interesting and very clear statements on this by experts who can really judge this, provided they speak out. Because many people don't speak out. And I've made this experience over more than a year now. And there are sometimes good reasons, sometimes less good reasons. But it's also clear that we had a lot to learn over this year and a half. The learning isn't over yet. The pandemic neither, and there will be other pandemics. But for many of us, this was a challenging time, and we were overwhelmed with many questions at a faster pace than we could answer in real time. So trade law didn't have the perfect answer if your answer is not from the perspective of one country, but from the perspective of the world. If you were the king of the world, or God, if you believe, then the answer would, of course, be that of equal distribution. And that is not the answer of trade law or law because of those exceptions and because of the national obligations on states. Here comes a relevant question being discussed now, and will be discussed in the future. Should there be stricter trade obligations? Should there be a trade agreement or a pandemic agreement just for such situations with no exceptions for export restrictions? Some people advocate that. I caution, I don't know any trade agreement without health exception. There sometimes are texts not containing it, but they're all interpreted so as to nevertheless contain a health exception. And I ask whether governments would actually sign up. That's a factual question. Would they respect such an obligation if it comes to a crisis and deaths in the thousands per day? And I even ask, are they entitled to enter into such international contractual arrangements, at least those that have national human rights obligations? Because that would prevent these governments from protecting their population in the event of a need. If you look at the European Union, you can observe very interestingly that the European Union internally, despite the law, which is similar to the international law, managed to decide on equal sharing, common purchase, and distribution according to population size. Fortunately, the epidemiology was always sufficiently parallel so that you could justify this equality. But the equal sharing is remarkable because some of these governments would have been able to purchase more vaccines faster for their population had they done it alone. But this is not transferable to the whole world because the European Union, the member states internally, have decided on a deep integration, not just economically, trade, but also human rights-wise and health policy. And they are much closer in solidarity in many other respects too. So there you can do this worldwide. I'm very skeptical. Lastly, production chains is also, of course, very important because otherwise you could, of course, say export restrictions are often impossible if you don't have production, forget it, or stupid if you don't produce the finished product or you don't produce the finished product alone. Yes, and that's very relevant, of course, but ultimately it's a factual question. It's the question of whether through an export restriction, a government can at all help the situation of the domestic population. And that can then get messy depending on where do the inputs of my vaccine production come from. And then you may have to do even selective trade restrictions, which of course are more beautiful, but can be necessary and can be justified. There was a question in the chat, and I can already answer it. Is self-sufficiency a good or a bad thing? Well, in international trade, we normally don't believe in that. But let me give you this example. If in a famine you need bread, then it's not a bad thing for every country to have a bread factory, right? Thank you.
Brilliant, thank you. Yes, now, Ambassador Bhatia, just very briefly to explain why perhaps, and look forward to what the next forum could be. The WTO, in a way, was the dog that didn't bark in this crisis. Could we talk about which forum could help with some of the matters that Lothar has laid out in terms of reaching an agreement that is abided by, not just an agreement itself, but one that has meaning and clout and enforceability and implementation? Could you speak to why the WTO hasn't worked in this instance, and which forum could come next in terms of trying to ensure greater equity going?
I agree with a lot of what Lothar just now said. The regulation that we have in trade law related to this crisis, provide ample space for WTO members to act responsibly and to act in the interest of their citizens. The issue is you cannot wish away nationalism. Nationalism is there, and countries will obviously try to prioritize the interest of their citizens over the rest of the world. But when you have a global crisis, whether it is climate change, whether it is this public health crisis, you have to find a via media of balancing the rights of your citizens with the responsibilities that you have towards the global community. And therefore, I think Lothar is right to remind us that we do not look at trade law through a narrow prism of what should be the responsibility and rights of a particular member, but you have to look at it in the larger context of human rights and so on and so forth. So to answer your question, why is this dog not barking? And that will take us to another debate about the political impasse which has been brewing in the WTO for several years now. The Doha round has been abandoned, the appellate body has been disabled, and so on and so forth. So there is a certain political impasse in the WTO which prevents decision making. Now, whether they will be able to take decisions which they are required to in the context of this global crisis, many people would be skeptical considering the depth of this crisis that we have. So do we need another forum? No, I think Carlos is absolutely right. We don't need new institutions. We just need to empower existing institutions to act in a way which fulfills their global responsibility. And I think it can be done. I think the first step has to be a sort of a political acknowledgement by the world leaders that this is a global problem which needs to be addressed globally. And I think a summit at the United Nations would be very useful to do that. It would set the tone for further downstream actions. You could have a pandemics agreement. You could talk about international financial institutions meeting the costs and so on and so forth. But I think the political ownership for the world community of this global crisis is paramount.
So if we could come now, I'm going to fuse together a question from the floor and a question we had in mind, which is let's address supply chain issues. Now, Lothar talked about every country in a way, there being a logic, a bread factory, every country having its own production mechanisms, as it were. So if we could deal with this question about the supply chain issue we see, the production issue we see, that was in a way neatly framed by Koen and others. We come to Rachel first, then I'm going to suggest that we go to Carlos and then Koen. And we're going to talk about, there are lots of state measures here. Sorry, to build on questions from the floor. There are lots of state measures here, and people are suggesting for the market to solve this issue. So what can or should the state do to protect supply chains? And what can it do when we're, say, 1 year down the road from here? Now, I know I've been looking at the financial incentives we need. So perhaps if we could start with you on that point, and then we're going to come to Carlos and Koen. Thanks.
Yeah, thank you, Anna. I mean, I think the point about the bread factory in every country is very poignant. And if I were an African country, I would not want to ever be in this situation again, where I am reliant on exports from either wealthy countries or India, which is where most health products are coming from in Africa, in an emergency, or even completely for routine purposes. I mean, I think we have seen the limits of the kind of free trade paradigm for some of these life-saving, life and death commodities. So if I were, any country, really anywhere in the world, I would be wanting to think, okay, what is the path forward for a secure supply of health commodities? And I think that will turn into a localization agenda for localized production of at least some health commodities and some backup capacity. And that could also include spare capacity for vaccines that could be accessed in a future pandemic, for example, so that it's sort of ready to go on the side. Now, the market will not solve this. This is not an economically efficient thing to do. That's why we have free trade, generally speaking. It's not efficient to replicate these processes of each country. But I think increasingly going forward, this will be seen as a national security imperative, not as a pure economic issue. So I would hope and expect to see increased subsidy from national governments going into creating some redundancies here. Redundancies in the supply chain, redundancies in manufacturing capacity, building and subsidizing and putting aside spare capacity that could be accessed in a future emergency. I think, wealthier countries or even middle incomes will probably find it easy enough to do this from within their national budgets as a defense measure. I think perhaps some African countries will need subsidy. It seems like development finance institutes are interested in helping them set this up. So I see that as possibly a path forward. Now, I don't think that's the immediate answer to this crisis. I think the time it will take to get that up and running is a longer time horizon. But I would expect that to happen, and I think it is probably a good thing. I think that, you know, as a Professor Bhatia said, we cannot wish away nationalism. We cannot hope that the next time this happens, even if we come to an agreement, as Lothar said, what's the odds that actually countries will abide by it when push comes to shove and their citizens are in danger? I think it's not a realistic scenario. So what we can do is create kind of redundancies and safety nets in the world supply chain, such that, you know, all countries have local production in these emergency type situations. But again, that will require government support, intervention, and financing.
Brilliant. Thank you, Rachel. And Carlos, if we could come to you there, your thoughts on how to address.
Okay, well, thank you for these questions. So let me address some aspects of them. In the first place, about the role of international law, it's important to consider that in the case of the WTO disciplines, these disciplines just say what governments cannot do. So these disciplines just limit the policy space. In the case of the World Health Organization disciplines, they should say what government should do in order to act in a pandemic situation. So the nature of the disciplines is very different, and therefore we should not rely exclusively on WTO disciplines. For instance, export restrictions, it has been mentioned several times here in other debates, but just excluding export restriction will not be the solution, because what we have seen in some developed countries is that companies were actually forced to supply the local demand. So whether it was an export restriction was not very relevant indeed, because through different measures, including subsidies, with conditions imposed in terms of which the companies would be supplying to, then export restriction wouldn't be the real obstacle for a situation in which vaccines could be shared more equally. So I will be a little more optimistic about whether nationalism in this context will always prevail. I think now there is an understanding that nationalism may be, as it was mentioned, self-defeating, because you cannot control a pandemic if you are not able to control it everywhere. So I hope that there will be a better understanding how these pandemics actually work and affect even those countries which are able to fast enter into vaccination step, because with the new variants, it is now well understood that it will never stop these stories to come again. So I'm a little more optimistic that in the context of a serious discussion about how to deal with pandemic in the future, there may be some measures that will avoid the situations to be repeated. I think that there is a lot to be done at the multilateral system, and as Professor Bhatia also mentioned, it will be important to strengthen the capacity of the World Health Organization to act in these cases effectively through new tools. So this is now the challenge, to give the World Health Organization tools in order to act effectively in situations like this.
Okay, brilliant. Thank you so much. Now, Koen, you've mentioned in your introductory remarks about how some of the most successful scalers of production have done so with just a few sites, and that there's some it clashes slightly with some people's views of this notion of a bread factory in every country that Lothar describes, because of the export restrictions we have seen, you know, and the failure of various forums that we've seen to build this multilateral consensus on how to approach things in a more equitable fashion. Could you address those points on sort of the benefits from some companies and perhaps the incentives that need to be created between governments and between companies, because we've got these two big forces together? How do we make this work? How do we do it? Do we do it with a bread factory in every country? Do we find a magic wand to get rid of the nationalism effect that can cause the problem between efficient manufacture and efficient distribution? Thanks.
Yeah, so thanks, Anna. That's a good question. In addition to the points made, I mean, let's be clear up front. If there is no production, there is also nothing to distribute. So we have a vaccine equity challenge because we have production that is ramped up in some countries, and then it has a distribution problem. As an international trade economist, I always said supply is demand, but something that was abundantly clear over the past year is that supply does not necessarily happen in the places where is demand or reaches demand, and that leads to shortages in other places. So that is the key question. I think what matters is you have two things. We have a short-term question right now in terms of production and in making sure that happens as fast as possible and then is being distributed. What is right now, given the timelines I sketched to you earlier, if it takes 6 to 12 months to retrofit a factory, now, if you start today, it takes 6 to 12 months. You're talking July 2022, you're ready retrofitting. There will be enough vaccines produced as long as they're being distributed. So you have a short-term question where there should be a focus on production and not on challenging or trying to disperse the production system that is now being set up. Because if you do that, you also create more competition for the raw materials that the current producers need. That's one thing. But your question is also of a longer-term question. What should be lessons learned and going forward for a next pandemic? The one thing we know is that we don't know when the next pandemic comes, and we do not know its nature. We may have something on the shelf that would work, we may totally not. And that's the uncertainty that goes with it. I really like the way Rachel said it at the beginning of her intervention. The uncertainties a year ago are forgotten, and we're asking how come we are where we are. Well, that is the answer, because of the uncertainty. So if you ask some of the ways forward, I think, by the way, one of you quoted the point that Africa feels extremely vulnerable. I'm working a lot in Brussels. I can tell you that the European Commission is feeling very, very vulnerable to imports from China and India, and is trying to look at how to reduce dependencies. If that is the case, if I look at that as an African country where the EU is the example of not being vulnerable, how do you square that? That's a relative circle. So I think you have a short-term pandemic preparedness question in terms of having availabilities to be agile and fast. COVAX, the idea is very good. Is COVAX funded enough? And was it funded enough early on to be a serious purchaser of vaccines in this case? We also have the uncertainty that the EU procured 400 million CureVac vaccines, and CureVac at the moment doesn't look very promising in terms of the results. So you may have signed agreements with producers that are late in scaling up, or that have vaccines that do not accidentally turn out to be effective. So there are these questions, and with that uncertainty, we have to live. So you have a short-term pandemic preparedness, and you have a long-term question on reducing dependencies. And I think the main point where the role for the WTO and for treaties is key from a production perspective is increase resilience of your supply chains. If there is fragmentation, one of the 280 ingredients of a Pfizer vaccine doesn't reach Belgium, there is no Pfizer vaccine. So that's the challenge we have. Now, I think also, therefore, that the WTO initiative, the Trade and Health Initiative, and others are really important in terms of learning lessons. And I would concur with Ujal and Carlos that a separate institutional setup that's going to be heavy and difficult and require consensus that's going to take decades is not what we need. So let's work with some of those clear perspectives, and at the same time increase short-term pandemic preparedness.
Fantastic. Now, we had a great question, which is really the framing question for this whole discussion. It's from Professor Peter van den Bosch, and it's asking, what is the most important lesson that we should draw from the COVID-19 pandemic for future global health crises? And as every great question, it's really two. If you could change only one aspect of the current regime, and being realistic about this, what would it be? So if we could come first to Ambassador Bhatia with that question, and then I'll come to, I think, each of you in turn. And I think maybe given our time constraints, let's use this as your moment to sort of like really sum up what you think your most important points are for today. So Professor Bhatia, if we come to you.
Well, that's a great question, Peter, but I will, instead of giving you 1 point, I'll give you 3 bullet points. First, I think various international law regimes need to be read holistically while dealing with global health crises. That's the first takeaway that I would have. Secondly, states need to intervene through coordinated efforts to counter market failures by strengthening existing institutions with stronger mandates. And the third thing is the economics of resilience. We should be careful it does not degenerate into plain protectionism. Thank you.
And then Lothar, if we come to you next.
Before my bread factory takes on a life on its own, let me stress that, of course, a vaccine factory and input is a lot more complicated than making bread. And maybe the truth and in the that there should be regional hubs, and you know that some of the thinking goes in that direction. I also want to say the WTO actually made a contribution outside of its real field of regulating international trade by bringing together people who can share the intelligence and knowledge on how to maximize and organize vaccine production. You find this on the website and can all watch it online. So maximizing production is, of course, one of the best things one can do. Carlos correctly said at the beginning that immunization is a global public. But when it comes to vaccines, for the economists among you, they unfortunately aren't. Public goods are non-rival and non-excludable. Yeah? Non-rival, I get a jab into this arm, and everyone else can use this jab as well. They're not public goods. We wish they were, then we wouldn't have a problem. Also want to answer Peter's question. Peter is the president of this society. If I change one thing, you know, I would be tempted to simply remove Article 11(2)(a), because it is an exception that also serves for commercial purposes, and I'm not sure we need this. For what we are speaking about, Article 20b is good enough, much better for answering the questions. But the whole export restriction regime of the GATT is asymmetric and has holes. Experts know this, and these problems actually are far bigger in other areas than the one we're discussing today, where the law is actually much better than it seems. When we think about decision makers, I think we also have to remember that they are active on an international arena, but also domestically. They like to be nice internationally and cooperate, but they also have an electorate to face at least every so many years in the democracies. And they took an oath. Yeah. I just give you the example that the German Parliamentary Research Service looked into the question of criminal liability for lawmakers who asked for this research because of manslaughter through omission, yeah, by not restricting exports. That may be a wrong lead, but just to show to you what these people must all have on their mind. There was a question in the chat on the security exception. Well, first let me say panel 4 dealt much more with patents and the TRIPS agreement, but I want to answer that the security exception is not the answer. A war on the virus is not a war in the sense of the WTO security exceptions, and a national health emergency or an international emergency, health emergency, is not an emergency in international relations, because that is for political crises between states. So otherwise, you know, all this waiver idea would also be off the mark, because the waivers are only needed and even allowed when there is a legal obstacle. So I want to conclude. There was also the question, is the EU scheme something that others could and should follow? Well, it certainly is much better than total export ban. And the good thing about the EU regime was the consideration of the epidemiological situation, both in the EU and in the country of destination. That's a very good model for what we are discussing. And lastly, I want to say that nationalism, we haven't heard the term very often this morning, but it is very present in this debate. It's a catchy term, but it's a bad term because no country has given preference to its nationals. Foreigners were always included. Second, speaking of responsible conduct, fulfilling human rights obligations. Anyone who found interesting some of what I said this morning can look forward to a detailed paper on this issue. Thank you very much for your attention.
Thank you so much, Lothar. Carlos, if we could come to you and you could offer us your one lesson and the one thing that you would change, having been through the pandemic.
Okay. So one lesson is that the principles of international cooperation and solidarity have been proclaimed, but they have not been practiced. So the international community needs to learn this lesson, and then for the next situation like this and for other situations, including climate change, for instance, there is a need to actually practice the basic principles of the UN Charter of International Cooperation and Solidarity. Otherwise, there will be no solution to a crisis like this. What should be changed immediately in a situation like this is the capacity to produce and distribute on an equal basis. So as we have seen, there has been the major problem. So there is a need to remove the constraints for expansion of production, which includes transfer of technology. This is not really something impossible. As it was mentioned, there are many plants around the world that could have produced these vaccines. Koen mentioned that by the end of the year, there will be 11.5 billion doses available. This could have been reached earlier if there would have been sharing of technology and capacity building as necessary. It was mentioned that between 2 and 4 months you can start production. This was not impossible, but there was not willingness to do that. And the governments, in particular, those of the company that host the companies that develop these technologies, did not make anything in order to incentivize their companies to transfer technology and increase capacity that will have prevented a lot of suffering and deaths around the world. So this is something, removing the limitations for the production and, of course, looking for a distribution system which should be based on international law. I really fully agree with a comment made by Professor Bhatia about the integration of international law, a holistic view, including human rights. And finally, just to respond to a comment on the security exception, my view is different. In fact, the South Center produced a paper. It was commissioned to a United States expert in this field, Professor Abbott. This paper is available on the website of the South Center, and it does confirm that the security exception could have been used and can still be used in a situation like this, because it's an international emergency in which governments may invoke this exception in order not to comply with obligations under the WTO agreements. Thank you.
Fantastic. Thank you so much. Now, come to Koen. Which is the one thing you've learnt and the one thing that you would change, having been through COVID-19?
Yes, thank you very much. And I think what is key, and that is highlighted, that the knee-jerk reaction at the start of a pandemic is to close, be protectionist, and to try and act in the interest of the small group of people, the national group of people you're responsible for. I think the long-term solution always lies in cooperation, and responsibility lies with all the actors. It lies with governments, national governments, to refrain from trade restrictions, to make sure that you increase the resilience of supply chains. It lies with the global dimension, the cooperation between governments in terms of a strong support for innovation, because that's what helps us come up with the vaccines we have today, as well as work at the WHO to strengthen the openness also in a pandemic situation. It lies with regulators. We haven't talked much about regulators, but they are vital for the process, the rolling reviews, but also global regulatory standards for vaccine production. Yeah, many companies offered to co-produce, but many of them were not GMP compliant or GCP compliant or GDP compliant, all the OECD standards. And that has to be the case. The reason EMA does not review the Gamaleya Sputnik 5 is because some of the vaccines were produced in a GMP incompliant way, for example. It's a point we haven't touched, but I think it's really important. And the last one is, of course, also the commitments from industry, the commitment to ramp up production as fast as possible, but also make vaccines affordable and available, as has happened, and go and stress the levels of cooperation that have happened. I mentioned the fact, and by the way, I just shared the link to the PowerPoint presentation in the chat, so everyone can see the slides that apparently I understood were not shared, but feel free to use them and ask questions. So the cooperations, if you talk about the 300 voluntary licensing cooperations with 220 including technology transfers, in a way, and I think this is in the end important, we haven't discussed vaccine hesitancy, but if you see how important good communication and trust is for people to want to take a vaccine, I've been in Russia many times, vaccine hesitancy there is so incredibly high, and they don't want to take it because they don't trust how it is being produced. So that is another element. It is the fast production of safe and high quality vaccines. And that's the commitment industry is giving. Thanks.
Fantastic. Thank you so much. And then Rachel, if we could come to you, so the one thing you've learned and the one thing that you...
Yeah, I mean, I think the one thing we've learned is that, you know, the limits of appeals to ethics, morality, and solidarity in a time of crisis, that is not a practical path forward, as much as we may wish it were. So I think from this point forward, we need to be thinking strategically about, well, how do we make it in everyone's self-interest to have a better situation the next time around? I think, you know, I hate to call it a silver lining, but as horrible as COVID has been, it's an important lesson for the world and how costly, how disruptive a pandemic can be. I think it's been a very academic discussion to this point where, you know, you have public health people sounding the alarm and everyone saying, okay, we'll throw a couple million at preparedness here and there. But we've brought the entire world to a halt for several years. I mean, the scale of what's happened is enormous. So I am hopeful that the next time around and in the interim, the resources will be made available such that we will not be in this position. A lot of these problems are solvable in the long term with money, with putting enough resources into vaccine capacity, into, I mean, we have all these debates about IP. You can buy out IP, you know, you can pay a company to build a factory. For enough money, all of this is possible. And this is honestly, you know, all of these measures would be the greatest bargain in world history, given how disruptive this has been. So I guess what I'm hopeful is that we will get out of this mode of penny pinching, that every country will look at how much they've spent on COVID relief and realize that it is pennies on the dollar to, you know, prevent and be more responsive to these and to be constantly catching up with new variants, new viruses, and emerging pathogens. And that the next time around, we won't be left appealing to people's kindness, that we will just sort of have the infrastructure in place that can be deployed.
And then we have a rare luxury of having been really prompt with everything because I've been bullying you horribly. So I guess I just want to open the floor and ask if anyone from the panel has an additional concluding remark, or if we're all content that we've covered most of our bases. I would invite all of the panelists to, as others have, if you have any interesting, useful resources that you want to put in the public chat that you think can help broaden the conversation going forward as we close, that would be fantastic. Otherwise, please just sort of raise your hand on screen the old-fashioned way panel if anyone has an additional concluding remark that they'd like to make. No hand. Oh, one hand. We have Ambassador Bhatia, please.
Yes, during the 1990s, when the HIV/AIDS problem was at its peak, there was a very strong debate around the world and in the WTO about intellectual property and so on. And in the WTO, it concluded with a Doha Declaration on Public Health in 2001, which basically emphasized, it didn't say anything new, but it did emphasize politically the right of WTO members to prioritize the public health concerns over their citizens while looking at TRIPS provisions. Now, if you look at it down the line about 20 years, that has not meant very much in terms of action. And for instance, the provisions for compulsory licensing have been very, very rarely used. I think the problem we need to sort of work on at this stage is, it's not about giving greater flexibility to national governments. It's about enabling, creating an environment where the world community can act together to find solutions. For instance, the issue of vaccines, and I think Koen and others have explained this very well, it involves a lot of technology. It involves a lot of value chain movement. It needs a cooperative framework to design all that. And one government cannot legislate its way out of a crisis by invoking, say, the Doha Declaration. So we go back to the original issue that we were discussing, which is the need to strengthen global cooperation through empowerment of institutions by giving them stronger mandates and so on.
I saw your hand fly up, so we'll come to you.
Thank you. I have said all the important things I had to say, but I can say one more useful thing, and it's a parallel to what Ujal addressed in the public health area, and it goes back to export restrictions. Every 10, 20, or 30 years, there is a scramble in the world for some resources. In the 70s, as the older ones amongst us know, and in 1975, Frieda Rössler wrote the first great law journal article about trade law and export restrictions, GATT and access to supplies. It took 30 years for this topic to be relevant again in round about 2008 and the years that followed, with raw materials, agricultural foodstuffs. And here we are, another 15 years later. So here I will criticize for once my class, my caste of people. Trade negotiators are myopic, but most of them, unlike me, don't wear spectacles. But one should act and regulate with foresight. Thank you.
I see your hand.
Well, thank you for the new opportunity to make a final comment. I think essentially what we have seen in this pandemic is that if you leave the remedies, the solution to the pandemic in the hands of the market, in the hands of a few companies, this will not lead to a global solution. Before COVID-19, 5 companies, a real oligopoly, dominated the 80% of the global sales of vaccines. So this is the situation we are coming from. And this situation has reproduced somehow, although there are new players such as Moderna, thanks to the massive subsidies that Moderna got from the US government. So there is the need to change the structure of the vaccine industry. In particular, talking about this issue. And this is the real challenge. And this can be done on the basis of expansion of production. Of course, there are technical requirements to be met. This is not impossible. So sometimes one has the impression that all the possible obstacles are just highlighted. Let's look at how to overcome those obstacles. How the industry, for instance, could have helped to expand such a production in a short term. The efforts were not made in that direction. So I think there is a need to change the paradigm for production, including to remove the obstacles and then get a vaccine industry in particular, which is not, again, dominated by an oligopoly, which in many cases even was responsible for shortages of vaccines, even pre-COVID-19. The situation also arose in pre-COVID-19. So this is something that I think we need to work on, and I hope that the instrument will be developed in the future to do that.
Thank you so much. Speaking of industry, Koen, you asked to make a final quick remark. Thank you.
Maybe I should change my final comment in light of what Carlos just said. No, I mean, just to be clear, I think the pandemic is already fundamentally changing a lot of how things are happening. Carlos, you say that there has been insufficient technology transfer. I think there have been technology transfers to the degree that competition lawyers were involved to see if there were no violations between competitors in terms of sharing resources and R&D in order to work together. Yeah, that's the degree to which knowledge and know-how has been shared between large competitors globally. So I think the fact that this is happening shows that especially the R&D process, given the riskiness, is something that is now at such a scale and such a level, you cannot engage at tiny levels. The whole element of how the industry is built is not because a few players dominate the industry because that's how it is, but that's because the scale economy matters. The scaling up of vaccines is easier if you have one plant than if you have 100 plants. There is no question about it, given the 280 ingredients you would need. It's very simple. And again, if in the long run, there are solutions to diversify this more, that is very clear. But I can tell you that, for example, the Pfizer decision to make the largest production plant in Europe had to do with the strong WTO multilateral trade-abiding stance of the European Union. It wanted to produce in a country where they would expect no export restrictions. This was not the case for the United States under the Trump administration. This was the case for the European Union. And that's why the Puurs facility in Belgium is the largest center of Pfizer designated to produce for the world. The point I want to make, and then I'll conclude, is the fact that the EU has had a joint procurement. There was a little point in the chat, but just to make sure that we make that point. The EU had a joint procurement system, and there has been a lot of critique to the EU for being slow and ineffective, but I think that's not entirely fair. The EU has also been doing this with 27 member states. And of course, for France and Germany, they could have done this themselves very easily. But if you talk about Malta or Cyprus or Bulgaria or Slovakia, the access was not that easy or quick. And the fact that this has been done jointly meant that I also saw a lot of sort of thank you messages from those countries to the Commission for having set up that scheme. Now, that doesn't mean we can extrapolate that scheme one-on-one for a global environment, but it does show that joint procurement can work if you provide the appropriate resources in order to do so, and the appropriate advanced setup the way Kovax is trying to do. And of course, Kovax was set up while the crisis was already unfolding, but that could be another important lesson learned going forward. Thanks a lot, Anna.
Fantastic. Thank you so much. And just a very, very last word. I mean, you've been so eloquent, Rachel, with just saying stop the penny pinching as being a very quick, straightforward way to really transform the situation at pace. Final remark using the last 30 seconds that you'd just like to throw in there, please do.
I'm being repetitive at this point, but I think it is just such a fundamental message. I mean, if you look at the sums of money that have been spent in the EU and the US and UK on COVID relief, and then you look at the pittance given to Kovax, and then you look at the fact at how unhappy British people are currently that they're not allowed to travel anywhere because now they have the Delta variant. I think that sort of says it all, right? Like, what are we doing? It's just sort of, when you abstract away a little bit, there's some absurdity about it, even just from a purely selfish perspective. So I think we need to sort of take that learning and insight and just be, be clear-eyed. This is a place we really should invest. Pandemic preparedness and response, I mean, it's one of the biggest threats alongside, global climate change that the world is facing. We need to completely rethink the amount of money and an effort we are willing to put into preventing this from happening again, getting out of this crisis. So yes, stop the penny pinching. That is my very repetitive message.
Thanks so much. No, but I think it bears repeating that when we have economic global financial crises, we tend to work together a little better that perhaps at times than we do when we have global health crises. So fantastic, and thanks so much to my panelists who have been fantastic. Thank you so much to SIEL for organizing and setting up this debate. And you can watch this debate back. I think that's really important to remember, or this discussion rather. It was all very cordial. You can watch this back, and I'm sure I'll be sharing some resources we've touched upon on Twitter as well. So thank you so much for coming, much appreciated, and take care.